Good afternoon, class. My name is Joseph Lamond, and today we're going to be talking about the glenohumeral joint, and I'm going to be demonstrating some movements, and I'm going to have my lovely wife demonstrate while I point out some of the major muscle groups used in these movements. So first we're going to get started with the abduction or abduction, and it will be started by the anatomical position, and we're just going to move our arm up, and that would be abduction, and then we're going to move the arm from the anatomical position slightly anteriorly and midline, which would be adduction, adduction. The next one we're going to discuss and demonstrate is flexion and extension. So flexion, we're going to turn to the side and have a better view. You're going to flex all the way up, and we're going to extend. You're obviously not going to have as much range of motion all the way back. All right, and now the next one we're going to discuss is horizontal adduction and abduction. So we'll bring it horizontal, 90-degree angle. We're going to perform adduction, bringing it closer toward the midline, and then abduction, bringing it back. And the last one that I will be performing before I have my wife step up over here is the external and internal rotation. So external rotation would be starting at the 90-degree angle, okay, and elbow in. You're going to rotate externally away from the midline. Then internal rotation, going to rotate inwards. Once again, trying to keep the elbow in and rotating toward the midline. All right, so welcome back. This is my wife Heidi. She's going to be helping us out today and demonstrating the glenohumeral joint movement or the shoulder joint movement, and I'll be pointing out which muscles we're using. All right, so now the movement we're going to be performing is abduction. All right, abduction. So go ahead and put your hand on the side and move it up to the side. All right, excellent, and bring it down about to a 45-degree angle for me, so we can show them. All right, so the muscles we're going to be using are the pectoralis major. Okay, so go ahead and turn. All right, pectoralis major, and the deltoid, the posterior and middle fibers. All right, and now the next movement we're going to do is adduction. So she's going to go ahead and bring it in. All right, and go ahead and turn the side for me. So we're going to be using the pectoralis major as before. Actually, I'm going to have you turn back one more time. Pectoralis major, and we're also going to be using the latissimus dorsi muscle. All right, and now the next movement we're going to do is flexion. Go ahead and flex your arm all the way up. Good. And I want you to go ahead and freeze it right there. So now we're going to be, you're going to turn a little bit. We're going to be using the deltoid, the anterior portion this time. Okay, go ahead and bend down so they can see. Okay, and then we are going to also use the pectoralis major muscle, again as demonstrated in the previous. All right, now the next one we're going to be performing is extension. So she's going to go ahead and extend it back. As before, we're using the deltoid. We're going to be using the latissimus dorsi and the pectoralis major muscle. We're also going to be using the subscapularis and infraspinatus. All right, so now the next movement we're going to be doing is the horizontal adduction. So go ahead and bring your arm up at a 90-degree angle, and you're going to basically punch over that way. Yeah, you're just going to reach along, and it's same thing as the deltoids play a major role in the glenohumeral joint movement. Okay, so I'm going to have you bend at the waist a little bit. Okay, we're going to be using the deltoids again, and as well as the pectoralis major muscle. Okay, and now we're going to move on to the horizontal abduction. Okay, so you're going to go the opposite direction. Okay, same thing. We're going to be using the deltoid muscle. Okay, and we're also going to be using the latissimus dorsi muscle and pectoralis major. Okay, the upper fibers. So latissimus dorsi muscle and the pectoralis major. All right, so now the next series we're going to do is the external and internal rotation. So go ahead and bring your elbow up right by your side. you're going to be moving inwards, and this is going to be internal rotation. Okay, and then going outwards is going to be external rotation. For the internal rotation, we're going to be using the deltoid and the pectoralis major. Okay, for the external rotation, we're still going to be using the deltoid, but we're also going to be using the infraspinatus. Okay, so it'll be just underneath the spine of the scapula. All right, welcome back. As you see, we have another helper. Getting a little fussy, so she's going to help us out. She's going to help help us find the other muscles. So now we're going to move on to the shoulder girdle, and which is essentially the scapular movement. Okay, so the first one we're going to be doing is abduction. Okay, so she's going to be moving her shoulder forward. Okay, and this is going to involve the serratus anterior muscle and the pectoralis minor. So serratus anterior is going to come up here, and the pectoralis major muscle minor is going to be right next to the pectoralis major. All right, now the next one we're going to be discussing is adduction, adduction. So she's going to retract her shoulder back, and we're going to be using the trapezius muscle. Okay, trapezius. And we're also going to be using the rhomboids. All right, now the next one we're going to be doing is the upward rotation. So she's going to bring her elbow up, okay? And we're going to be using the trapezius as well as the serratus anterior group again, because remember, we're moving the scapula to move the shoulder. Okay, so it's going to pull up, pull to the side. It's going to cause a greater angle. Now we're going to go to the downward rotation, okay? And for the downward rotation, we will be using the rhomboids and pectoralis major, okay? So she's going to be moving it down, okay? So rhomboids, and then the pectoralis minor, pectoralis minor, turn around, okay? Just underneath the pectoralis major muscle, it's a smaller group, and once again, it'll be helping retract the scapula, moving it down, creating that angle to bring the shoulder down. All right, now the next movement we're going to be doing is elevation. Okay, so she basically a shoulder shrug. She's going to shrug her shoulders up. We're going to be using the trapezius muscle as well as the rhomboids. Okay, all of these are going to help lift and slightly rotate the scapula when you come up. Okay. Now we're going to be moving on to the depression. So the opposite, you're going to bring it down. All right, and you're going to be using the trapezius lower. Okay, so it's going to be pulling it down, as well as the pectoralis minor. Okay, so same thing as we've pointed out before.